So now it's time for the next speaker, and that is Dr. Stefan Konigorski. He's a senior researcher and head of the Health Innovation Analytics lab at the Landberg Institute in Potsdam in Germany. He's also an adjunct assistant professor in the biology department of artificial intelligence and human health at the Lankinen School of Medicine at Mount Sinai in New York. In his research, he developed computational tools and statistical methods for designing modern trials and estimating possibility, with specific focus on personalized digital health intervention using NL1 design, micro-randomized from reinforcement learning. And his topic today is new study design for precision. Please.
Thanks for the introduction, and very happy to be here and to talk to all of you about new designs. So let's see how new they are. But my hope is that at the end of this talk, I've shown you maybe some new perspectives on the one hand side, but then also hopefully shown you that actually those can be very well related and possibly integrated into what we've heard so far. So that would be my aim. I'm also very happy that I'm following lots of the talks we just heard, because there are a couple of things I can directly pick up. Among others, I wanted to tell you first that actually I don't want to talk about precision health, but about personalized health. And so maybe one of my aims in the first slides will be to tell you what I think of the difference between those two is and what this new perspective is. So with that, let's start now with a patient view in the first place. To actually look at personalized health, we can ask Alexa or someone else, which diet should I follow to possibly improve my health? If we're talking about prevention, or then also about treatment, also which diet should I follow to avoid getting sick? So that's really the patient perspective that we can take in here in asking, what should I do? Which diet should I use, or which nutrient should I use, or which nutrient should I avoid in doing this? Which is slightly different than actually what we might be thinking of as physicians, as researchers, where we more generally think about what contributes to personalized diet, to avoid, or again, maybe the same question, improve health or avoid getting sick. So having said that, and also trying to integrate that patient perspective, how can we target those questions? And I would argue that we've heard lots of talks in this session, especially on this question in here, where I don't have to convince anyone here, I think, that taking studies on the average patient, on traditional cohort studies or randomized trials, is the best way actually in telling me what I should do. So we can do much better than that. And we've heard different studies on, that I would call precision nutrition, precision health, where we're trying to stratify, essentially. And we can stratify very well based on metabolomics, based on genetics, which can work very, very well in many instances. But I think still the question remains, what's the heterogeneity that's left, and how similar is actually everyone? So if we have a very specific genetic, molecular, metabolomic signature, is that applicable, and does that tell me for a given person that fits into that signature what that person should eat or not eat? So I think that question still remains, where another perspective that you could try out is to look at N-of-1 trials. So that's a study that I will try to tell you about in the following. But I'm always curious and asking, like, actually, who has heard of that before I'm telling you about this, but I'm skipping that question for now. So that's what I'll try to tell you and get you close a little bit to all of you, which takes that perspective really from the patient, but then can be very well integrated in what many of us are doing in their studies. As a definition, we could say N-of-1 trials are multiple crossover trials in a single participant. Actually, what an N-of-1 trials is, I think there is still some confusion in the field of N-of-1 trials. You might read that it's a single person RCT. I would say, actually, if you look closely, it's not in some sense, because there are differences between what you randomize and what you control for in N-of-1 trials compared to RCTs. But we're looking at a participant, and we want to perform a trial in the single participant, with the aim really of looking at individual causal effects. So look at one example here. If we want to compare two diets, the blue and the yellow one, or two different nutrients, or leaving out different nutrients. So you can replace that with your favorite question at hand. Then an N-of-1 trial. It works here. An NFON trial would set out as a control trial. So you set up the design of your trial at baseline, where you do a longitudinal follow-up, where you would set the sequence of phases when you would apply the yellow and then the blue, possibly again the blue and the yellow dye, and you would record data over time. Which from that perspective, I guess, is not very different from what we've seen so far, that you might do a crossover trial. We've just heard, I think, in the last talk about one of those examples in here. With the difference being now that if you record data over time on that single patient, you could analyze the data for each patient separately, and you could try and figure out the statistical inference on each patient in telling that patient, well, actually, this works for you and that works for you, which I think very rarely we're actually doing in cohort studies, which we're not thinking of. Maybe we're not interested actually in the single patient, but then if we're running those trials and we're getting those insights anyway, we might feedback those results to the patients, right? So that's definitely one of those perspectives that I'm trying to tell you about. What we might do, and what I think we could very well integrate into many designs that we have, where we're recording that data anyway, we're having those people followed up over time. There are considerations, obviously, in NFON. So if you consider those trials, and maybe if I'm getting you to think about, can we integrate that into my study of interest? What do I need to think about in terms of those trials? One question definitely is about the study design, about how many intervention blocks meaning like here one block, or we maybe have 3 days where we do that intervention, likely more 7 days or 14 days. So the number of those blocks, you would have 1, 2, 3, 4 blocks, but then also how long should each of those blocks be? So should we do 7 days of yellow, 7 days blue, 7 days blue, and 7 days here? Should we even do maybe yellow, blue, yellow, blue? So there are several more considerations that you need to think about compared maybe to the standard RCTs where we have that much more established. So that's about sample size calculations. Secondly, we do have to think about run-in time, watch-out time, like in other crossover trials you have as well. Just like randomization and blind. So I do think that there are lots of challenges if you think about this. Randomizing a single patient actually also, so what are we actually talking about here? We're not talking about randomizing people to arm A or B. We're talking about possibly randomizing the order of A's and B's, or not. And it's actually still a lot of work going on. We're just in a very recent preprint that postdoc with me, Marco Piccinini, put out. We're trying to put that apart and just provide a causal framework. And so I'm thinking about what do we want to estimate? What are the estimates of interest? Where there are lots of methodological challenges that I would say, though, are very important and that we might all have to think about in trials that we're running in the studies, like what are we actually measuring and what's the timeline that we're expecting the effects of our diet to work. And just by putting that into the picture and assessing those possibly on a daily basis, that also can allow us to actually then do those fine-grained analyses. Once you have such a trial on a person, and you possibly run this with multiple persons in so-called series of NF1 trials, you can aggregate those trials again more efficiently than general RCTs. Sounds nice, right? So you can run those trials, you get the individualized treatment effects, you also can get the population effects, possibly even more efficiently with less patients. So why have maybe not many of you heard of this, or why has it not been standard practice? I do think there are definitely several barriers that we've tried to work on to then bring out really the full benefits that you can possibly link personalized medicine, you can feedback results to the patients even in the trial, link this directly to clinical care if we compare treatments or interventions for a single patient, but then also even link this back to population level studies. I do think that one of the challenges has been that if you wanted to design such a trial, you had maybe to develop your own employ a software development team. And otherwise you would have to come in the patient like every day to ask them, how do you feel today? Which is just infeasible. So there have been many attempts of bringing those NF1 trials into more broader research. Though we've set out and trying to develop a platform that allows you to do those more easily. So essentially integrating ecological momentary assessments, maybe that's another way you've heard of those, into trials. So I've tried to set up a platform that makes this easy for everyone to use, an open source, free software platform that allows everyone and you possibly to design such a trial that might be nested into the trial that you're running. Once you're doing this, then also build a repository of the results. So we're trying to build here as a repository where the study results, the raw data, is stored anonymously and published through this platform here, and then also provide the feedback to the patients. So with that, there are many interesting questions to think about where this data is stored and how does the researcher interact and how does the patient interact. So these are two apps we've written. These are the URLs, if you want to have a look, that are freely accessible, those two. And obviously then there are also questions on data security, data storage that are very interesting and coming up in the projects that we're running on this platform. To give you an idea of some of the trials that are running on this platform, let me start off with those trials here. We're actually currently, this is one trial that is running at the moment. We have several others on fasting, which is a very interesting interventions, also compared to the traditional setup you have in those NF1 trials. Because obviously, we're thinking about what's the effect and when do you expect an intervention effect. And I showed you earlier that you might have phases of A's and B's and A's and B's. Fasting, you might not stop fasting, then jump back into fasting. So that's a very different setup where you also might expect effects to work more long term. So the design here is also very interesting. We're looking at fasting, for example, and its effect in breast cancer survivors, and now also in chemotherapy, cardiometabolic disease. So these are different studies where we're looking at the effects of fasting. Others are then outside of nutrition generally. So we're running different studies to give you just a flavor of the trials that are also running in here on stress interventions, so behavioral interventions in their antidepressant use, on sleep health or acne, as some of those studies. As well, and these are now some of the studies where we're starting, where we're trying to integrate this into clinical care so that the physician gets together with the patient in designing and choosing which interventions to run, and then running those trials on the platform, possibly feeding back those results into the platform and into the clinical records. So those were some of the trials to give you a flavor of the studies that are running. I do want to mention also some methodological work that we're doing, where I do think that the second pillar for bringing it into broader acceptance, possibly, and also maybe into more studies, where the first place is really just allowing this to run easily in a digitized way. The second part is I do think that there are methodological challenges that have prevented this from being used frequently. Some are that very often, in most of the studies you're looking at, it's not clear what people are actually measuring. So what's the estimate of interest again, and what are we thinking when these effects happen? So we're trying to work on some causal inference framework on this. Similarly, the status quo was, with your textbooks also, if there's any carryover of the treatments, of the interventions, of the diets you're expecting, don't do an NF1, which obviously prevents many of those scenarios to happen, because you might hope that if you follow a different diet, then you lose weight, for example, and that you don't want to go back to your original weight before you start the next trial. Trying to model those then in different statistical methods, that's one of the things that I think can make this much, much broader accepted. The last point here, I think, is now where things, again, differ a bit from the traditional cohort or trials perspective we're doing. So if you're running those trials, and if you want to get the patients, participants on board in participating in those trials, feeding back results, and we're telling you, hey, this is great. We can tell you after the trial whether this worked for you. We'll tell you in a year. Fill out, like every day, we're going to tell you in a year which worked. Well, if you can convince them, but I feel maybe many of them might go away, or they might say, well, I'm using all those apps on my phone that show me results daily if I want. Can I not do this in these NF1 trials? That's some of the work we're doing. We've started to work on here and thinking, can we provide results in a trial, and how do we have to model this in a statistical way? Other perspectives are, and that's more technological now, integrate sensors. So if we had sensors available that could be on measuring physical exercise, other measures to maybe assess diet or questions on a non-invasive way, or in a way where the participant does not have to report daily, that would alleviate a lot of the burden that participants might face, and also allow trials to run a little shorter. because we can gather a lot of data and then very, very easily perform these analyses. And that's why one study we run actually recently, where a group was led by Joe at the HPI, they had looked at gait. So how you walk and how fast you walk, performed population level studies, did not find the effect that they were interested in seeing. But then since they had the data and using IMU measurements, we would have data on a very, very frequent basis. We started to look at those trials on an individual basis, and then you could see that huge variability where you could see an effect in everyone essentially, but by grouping, you was not able to see that. Another very interesting part here is that what if you can capture the outcome of interest by images, by audio, by video? What if you take a picture of what you just eaten and you run some deep learning model on this where you don't have to grade this? So that's some of the work we're working on, because you can take a picture easily of what you just eat, or you can tell a story to your smartphone. So making this scalable, then you can integrate some deep learning models. And the last part I wanted to mention here is that adaptive interventions. So especially, I think, for nutritional sciences, you might not be interested in comparing diet A versus B. All right, after 2 months, we're starting then an adaptation of A versus B. But let's learn during the trial using some reinforcement learning what works, so that we can both learn which works and adapt the diet, and then also at the end do this inference based on this. For that, there are lots of students and groups involved. If you're interested in it, try it out.